All right, I think we're ready to go, so we'll make a start. It's just lovely to have you with us this morning. Thank you so much for being with us, and thank you for joining our World Elder Abuse Awareness Day Forum. This year's forum has a theme of building resilience. ARIS has been holding this forum for 16 years. Every year. The last 3 have been online, and we've got fingers crossed and really hoping that next year will, at least for some of us, be face-to-face, and the opportunity to have those side conversations and get to hear what everybody's doing in this space. So my name's Anne Burgess, and I'm your MC today. I've been with ARIS, with the ARIS board since 2016, and I'm currently the chairperson. But we're really fortunate today to have Uncle Frank Wanganeen, who is going to welcome us to country. Uncle Frank is a Kaurna elder born in Wallaroo on Narungga country. So over to you, Uncle Frank.
Thank you, Anne. It's really good to be on this webinar, and I really sort of miss having that face-to-face with people, especially at the conference that we have here in Adelaide. I really enjoy that because it gives you that opportunity of networking with a whole range of different people, and it's great to sort of connect and with the wider community. So now I'm just doing the welcome in the Kaurna language. Nai Tampadi Tuila Berkayana. Nai Tampadi Bamba Balyarendi, Kaurna Yurtiana, Martichunga Kaurna Miona, Nai Wangadi Mani Nai Budni, Kaurna Yurtiana, Tarndanyanga Wadliana. So what I just said in English is that I just want to acknowledge the ancestors and also recognise where we're holding this webinar is on Kaurna country. And on behalf of the Kaurna people, I just want to welcome you to Tarndanyanga, the place of the red kangaroo. So thank you.
Thank you very much, Uncle Frank, for that warm welcome. And we welcome people all around the country today. We've got over 620 people registered for this event, the most we've ever had in this ARIS conference. So it's really, really thrilling to see how many people are interested in this issue and want to find ways of addressing it. And so thank you also to our very generous panelists who have taken time out in this very busy time to be part of this forum. Of course, these forums couldn't take place without sponsorship, and our sponsors today are really important to us. So our champion sponsors are Dementia Australia, Aged Care Industry Association. Our supporter sponsors are the Adelaide PHN, ECH, Rest Haven, Southern Cross Care, the South Australian Community Visitors Scheme, and Flinders University Research Centre for Palliative Care, Death and Dying. So just before I start, I want to go on and tell you a bit about housekeeping. We are recording today's forum and we'll share a link with you after we've finished. And you're welcome to come back and have another look at the content and share it with all your colleagues and networks. So I'm sure you're all familiar with the webinars these days and know about the questions. So on your screen, you'll find a Q&A box. Please feel free, if you think of a question, to put it in there and the name of the speaker if you want a particular speaker to answer that question. We'll try and get to questions as we go through the morning. And if we can't, we'll find a way for ARIS to respond to your question later on. So without any further ado, let's get underway. We want to know a bit about all of you who are with us this morning. So we'll put a couple of polls up in just a few minutes on your screen, and that'll help us to identify who's with us this morning. So Sakina, can you put up the first poll, please? So feel free to let us know. So the answers are still coming in, so I'll leave it a couple more seconds. Thank you very much for that. I think if we end that poll, and we can see that 34% of you are aged care and community service providers, 18% are health and allied health professionals. We've got government employees, 16% education and training organisations, 6%, 3% community members, and 3% researchers. So that's great. Thank you very much. And now if we will go to the second poll. Thank you, Sakina. And this is where you're from, so we can see. So if you can, I think we've got everybody in. Sakina, if you could end the poll now and share the results. So we've got 36% in Adelaide Metro and 13%, that's really good to see, in rural and remote. 47% of you interstate, 49%, sorry, interstate, and 2% overseas. So thank you very much for everybody. That's really interesting for us to know so that we can pitch the content appropriately at these conferences. So thank you very much. You could take that down, Sakina, now. Thank you. Right, so the theme for our 2022 WEAAD is building resilience. So I thought it was really important to start with to be clear about what elder abuse is so that we're all working for something of a common definition. So it can be defined as a single or repeated act or lack of appropriate action occurring within a relationship where there's an expectation of trust, which causes harm or distress to an older person. And elder abuse can take various forms such as physical, sexual, psychological, financial, and or neglect. So according to the National Elder Abuse Prevalence Study 2021, and we're going to hear more about this study later on this morning, 1 in every 6 people over the age of 65 experienced abuse in a 12-month period. 1 in 6. I hope that number sticks with you as it stuck with me. And that's whether it's psychological, neglect, financial, or physical. And only a third of those victims seek help from a third party. We also know that elder abuse is more likely to be perpetrated by a person who the older person trusts. We know that COVID-19 has tested some of those trusted relationships. So how do we as a community come together to support each other? If we're service providers, how do we bounce back and strengthen our service responses while continuing to build community awareness to create the momentum for change and strengthen the safeguards for vulnerable older people? So we know we can all do our part to improve the overall well-being of older Australians. And the number of you who are on this webinar this morning indicates there are lots of you that want to do that. The support of family, friends, and community services can assist older people in retaining control of our lives, enhancing our well-being, and helping us to maintain our independence at home. Together, we can work together to ensure older people are aware of the supports available and how to access them, and build resilience to support older Australians experiencing abuse, and build resilience in safeguarding older Australians from abuse, build resilience in providing a supportive environment so older Australians have longer, healthier and more productive lives free from abuse. We're going to explore this and a whole lot more today. While I've got the floor, I just want to say that ARIS has got some exciting news as well. You can support the work that we do by becoming a member of ARIS for a very small amount of dollars. It's a great encouragement to us in our work, and it connects us with you as we do our work. So if you have a passion for the rights of older people, I would encourage you to go to the ARIS website to learn more and to register. Of course, I need to give a disclaimer that any material or views expressed today are the views of the presenters and not of ARIS. And as usual, the material presented is also of a general nature. If you've got a particular issue, you need to get professional advice for your individual circumstances. And now we have a message from the Honourable Chris Picton MP, the newly appointed South Australia Minister for Health and Wellbeing.
Well, thank you very much for having me help open the Age Rights Advocacy Service World Elder Abuse Awareness Day Building Resilience online forum. I'm honoured to be part of this forum, and I'd like to acknowledge Anne Burgess, the chairperson of the Age Rights Advocacy Service and the Master of Ceremonies. I'd also like to acknowledge Uncle Frank Wanganeen, Kaurna Elder, and all the other very important people who are taking part in this forum today. I also acknowledge that the land I'm meeting on is the traditional land of the Kaurna people. We pay respects to elders past, present and emerging. And I also pay my respect to elders of other lands where some of the forum participants may be located today. I'm honoured to help open the 17th World Elder Abuse Day Forum, and I thank the Age Rights Advocacy Service for their continued work and dedication over the past 16 years to making the conference possible. This is a theme today that we have of building resilience lends itself to older members of our community. When we consider those over the age of 50, we're talking about more than 4 generations of older South Australians. Among them, we have survivors of war, survivors of the stolen generations, pioneers of the women's movement, custodians of First Nations culture, and those who, with their own hands, have built our community. Amongst this cohort, we also have some of the most resilient people on earth, many of which are active participants and pillars of our community. Yet we know that this resilience is too often tested and eroded by ageism, discrimination, and by abuse and mistreatment experienced by 1 in 6 people over the age of 65, often from someone that they love and trust. Ageism can result in older people feeling invisible and unheard, and can diminish their sense of worth. If it remains unchallenged, it can intensify vulnerability, causing withdrawal, isolation and despair, and affect their ability to be involved in the broader community. The Malinowskis government is committed to taking a whole-of-government approach to health and wellbeing, with our older South Australians being a priority, acknowledging that tackling ageism in all its forms is fundamental to safeguarding older people's rights, preventing abuse, and creating a community that values and accommodates the needs of older members. One initiative committed by the Malinowskis government recently is the provision of free public transport to senior card holders. We want to see older South Australians getting involved in their community, accessing the best that South Australia can offer. That's why we're making public transport free all day, every day. COVID-19 has also presented significant challenges to our older South Australians and has increased the potential for people to become more socially isolated and lonely, negatively affecting their mental well-being. To ensure the state's elder abuse prevention, awareness and response policy continues to lead the nation, a new strategy to safeguard the rights of older South Australians is currently being finalised. It builds on extensive work undertaken since the commencement of the previous strategy in 2014 under the previous Weatherill government, with a range of partner organisations in and outside of government, many of whom are part of today's forum. A statewide engagement to develop the new strategy, facilitated by the Australian Centre for Social Innovation, engaged more than 2,400 older people, community organisations and other stakeholders, inclusive of those who are often marginalised and difficult to reach. The new strategy will align with the life course approach to living and ageing set out in South Australia's Plan for Ageing Well. It aims to raise awareness and identify opportunities to prevent and respond to the abuse or mistreatment of older people, focusing on tackling ageism as a core element. A range of early actions to support the implementation of the new strategy will begin this year. I thank the many partner organisations who will implement a diverse range of projects to help deliver on the strategy, including a substitute decision maker toolkit in partnership with the Office of Public Advocate, rolling out abuse prevention training for community centre staff and volunteers in partnership with Community Centres SA, and co-designing a theatre performance with the Adelaide Fringe Festival. Many of you will know that the Adult Safeguarding Unit was the first of its kind in Australia. In the past year, the Adult Safeguarding Unit has received more than 2,000 calls, with more than half relating to concerns about elder abuse. As required by the legislation, an independent review of the operation of the Ageing and Adult Safeguarding Act 1995 is currently being conducted by the South Australian Law Reform Institute. The Act enshrines both the Office of Ageing Well and the Adult Safeguarding Unit. The Law Reform Institute is currently conducting statewide consultations, which commenced on the 16th of May and will close on the 30th of June. I'd like to commend the Age Rights Advocacy Service for organising today's World Elder Abuse Day online forum and the opportunities it provides for us to create a community that respects older people and paves the way to build and reclaim resilience as we age. I've enjoyed taking part in previous forums. I hope it will not be too long before we can meet again in person and continue this incredible work together. So I'd like to thank again the Age Rights Advocacy Service and all the key partners of today's forum for what I'm sure will be another successful movement towards making sure that we stamp out ageism and abuse in South Australia.
Thank you, Minister. And the Minister's message of respect for older people, I think, is reinforced by an elder abuse prevention tackling ageism campaign that's been recently launched by the Office of Ageing Well in South Australia. It aims to raise awareness of the link between ageism, respect, and abuse and mistreatment of older people. Here's a short clip.
Ageism takes away my rights, the right to make my own decisions, be safe, and be treated with dignity and respect. Sometimes people assume I can't do something because of my age. They exclude me, and I feel invisible and sad. Ageism can lead to mistreatment, neglect, and other forms of abuse. How do you treat the older people in your life? For more information, search SA Health Tackling Ageism, a message from the Government of South Australia.
Thank you. I'm thinking that those words, rights, dignity, and respect, we'll hear a lot about this morning. So now it's my great pleasure to introduce Carol-Ann Barkla, who's the Chief Executive of ARIS. And Carol-Ann's going to provide an overview of the work of ARIS over the last year. So thanks, Carol-Ann. Welcome and thanks. Over to you, Carol-Ann.
Good morning, Anne, and good morning to everyone who is on this webinar. I'm the CEO of Age Rights Advocacy. It's a privilege to lead the operations team of ARIS, and today I'm going to give you an overview of what ARIS does and talk about what we have been doing. So next slide, please, Sakina. Thank you very much. There's a slight delay for me in here. So ARIS has been supporting older people in South Australia to uphold their aged care and human rights since 1990. So it's 32 years that we've been doing this. And really, it is about older people being able to be engaged in issues that they are concerned about and having their voice heard on those issues. We provide individual advocacy, information and education. We're the South Australian member of the Older Persons Advocacy Network. We are independently accredited against the ACES accreditation for community services, and we're funded by the Department of Health under the National Aged Care Advocacy Program via OPAN. We're also funded by the Office for Ageing Well, SA Health and CODA Australia. Next slide, please. So what do? We're actually funded to support older people who are living in residential aged care homes to raise issues about their service provision. We're also funded to support older people who are receiving home care or home support, funded by the Commonwealth Government to raise any issues with their service provision. We also support older people who are experiencing or at risk of elder abuse by family and friends. We also have a program that supports older people who are living in retirement villages who are experiencing issues with their operator. We also have Aboriginal advocates who are able to work across our programs and provide culturally safe and support to Aboriginal elders and older Aboriginal and Torres Strait Islanders people. And the Aboriginal advocates also lead an Aboriginal intergenerational mentoring gathering in a regional location each year. ARIS has also been participating in the Aged Care System Navigator trial, which is located in particularly the northern suburbs of Adelaide and also the Barossa region. Next slide, please. So here's some fast facts about ARIS and who we supported in 2021. So you can see by all of these numbers that ARIS totally supported over 11,000 people via individual advocacy or information, or also to understand their rights. We had a 25% increase from the previous year. And I just wanted to really point out that 163 people were supported and intensively supported to access aged care services. That means that more than just registering someone on My Aged Care, the navigator walks alongside of the older person to ensure they actually get the services. So it's really critical service, and that service will transition into care finders later this year. Next slide, please. So who did we work with? So predominantly, you can see in this slide, we've got the older person in the centre, and that's because we only ever work with consent of the older person. But you can see that we have really strong connections, and we receive referrals across from multiple other people. So you can see aged care staff who identify abuse when they might be working in the community, but also in aged care facilities, but also family and friends might provide support to an older person who's experiencing abuse. We also have 4% of contact is from GPs and nurses and allied health professionals. Next slide, please. So the types of abuse in 2021 were predominantly sitting within the psychological and financial abuse areas. So misuse of power of attorney being part of that as well. Next slide, please. So we looked at who was perpetrating the abuse, and as you can see, primarily the abuse is being perpetrated by immediate family members, and significantly, it is adult sons and daughters, and then we also do have spouses as well. So 80% of perpetrators are actually family members. Next slide, please. So the risk factors for older people experiencing some form of abuse from our data is really family conflict, cognitive impairment, lack of information, living with the abuser, and psychological dependence. We work closely with agencies such as the SA Adult Safeguarding Unit, the Aged Care Quality and Safety Commission, the Office of the Public Advocate, Public Trustee and Legal Services Commission, to name most of our key agencies, to stop and prevent further abuse of older people. Next slide, please. I thought it was really important to give you a quick snapshot of our current data, but I need to just say that this data, we've still got several weeks to go, but I wanted to really draw attention to the issue of older women and sexual assault. And in particular, I think it's really critical to acknowledge that OPAN and Celebrate Ageing and also the Older Women's Network are really running a campaign at this moment to really shine a light on what is happening to older women, particularly in residential aged care, about sexual assault. It has long been a taboo subject, and we really do need to start talking about it. Next slide, please. So once again, our preliminary data for 21-22, you can really identify who is actually perpetrating the abuse. And I think it's overwhelmingly family members. And you can see that we have a percentage there of 3% of staff. And you can also see we've got level pegging, sons and daughters, spouses, and multiple family members. It's really, really important to understand that our data is just data from one service, and really there should really be a significant approach to data and national data collection approach in the future. Next slide, please. So COVID-19 has been a significant impost and disproportionately impacting older people. So what has ARIS been doing during the COVID pandemic, and in particular the last year? We've been providing individual support, in particular in raising issues of access and visitation and making sure that older people are being able to have visitors. We've been undertaking weekly meetings with the Federal Department of Health to articulate any concerns that we're hearing about. We've been in the daily meetings with the Aged Care Emergency Management Response Group led by SA Health, and includes the Commonwealth Department of Health, the State Control Centre, ClinPath and ARIS, and we're able to raise issues around: are older people receiving visitation? Are they able to receive timely vaccination? Are they able to receive treatment and access to any other healthcare? And we continue to raise those issues. So we've also been supplying a communications toolkit and able to support homes with family meetings. And in particular, I know the operations team have been talking quite often to aged care providers about what processes have you got in place to ensure that older people are actually able to exercise their rights, have visitors, and focusing on balancing that very difficult issue of infection prevention, but also ensuring that older people's mental health and wellbeing is being respected. We continue to have weekly meetings with the aged care sector to ensure that there is a timely response. So if we're hearing about workforce issues or access, we're raising those, and we're doing that at this state level, but we're also raising it via OPAN and also directly to ministers. So things like ADF support and access to additional workforce to support services is really, really important. Next slide, please. So systemic advocacy that we've been working on. Retirement villages, we've been working closely with SAVRA and CODA to raise issues around exit fees and also critical things around how management respond to complaints. And we will be meeting in July with the Minister to raise those things. Powers of Attorney Act review. There has been a review done by the South Australian Law Reform Institute, and we will certainly be raising the need to implement those recommendations, including the recommendations related to prevention of financial abuse. Restrictive practices, we've been working with a group of interested parties to raise our concerns with government about restrictive practices use, and also to consider the Royal Commission into Aged Care Quality and Safety recommendation that there should be an independent authorising officer. In terms of guardianship and administration, we continue to raise our concerns about the lack of support and also representation at SACAT hearings. We fully acknowledge that the Legal Services Commission is actually able to, is funded for reviews, but we see that as putting the cart out, essentially it's not able to support people when they're actually having their rights taken away initially. We have supported witness competence and evidence submissions, where nationally we have been focusing on the aged care reforms, and we welcome the new federal Labor government's commitment to progressing those reforms. And I draw your attention to EAAA and the blueprint, A National Shame. You must look at that. That was recently released and it is critical. It has 5 areas to look at. Next slide, please. So what is ARIS doing? ARIS is expanding. In line with building resilience, we see resilience as being getting closer and connected to networks and communities. So shortly, we will be opening a new office in Nuriupa and in Victor Harbour. And we've just received news that we will also be opening an office in Berry. The other thing that ARIS has done is we commissioned our own unmet need and demand study, and which looks at the growing population of South Australians over the next 10 years. And no surprises, we are an ageing population, and we're also looking at how we can better provide service deliveries in those remote locations. So I encourage you to engage with ARIS, provide feedback, and thank you for listening. And if you need to contact me, that's my email, and I'm very happy to discuss any issues or welcome your support. Thank you so much.
Thank you very much, Carol Ann. So there's a number of points that you brought up there that people are asking questions about. So if you can come back on screen, I'll ask you these questions. Somebody has asked the question is, can you describe what the interagency work with the Adult Safeguarding Unit looks like?
Okay, so the interagency work with the Adult Safeguarding Unit, or are we talking about the Emergency Management Directions work?
No, the Adult Safeguarding Unit work.
Okay, so the interagency work with the Adult Safeguarding Unit. I suppose I'm unsure what that means. I mean, we work in partnership with referrals back and forth informally.
Yeah.
And so that certainly happens across a number of agencies. So informally, older people can, or various members can ring the helpline or the adult safeguarding unit, or they can ring ARIS. And certainly we have an informal approach at this moment, which is the best approach.
Okay, thank you. And you mentioned the need for data. I'm sure that'll come up this morning in lots of people's presentations. But Tanya says, is there any data on perpetrators of abuse and whether or not they're aware that their behaviour constitutes abuse?
Yes, so I did put up a slide in terms of data on perpetrators. And certainly we have some data, and I suppose I'm referring to the, when I talk about data, there is no national repository of data.
No.
So we have different data collection sets. We have no national set of agreed data at this moment. I think the presentation later from the Australian Institute of Family Studies prevalence study might provide us with some of those things.
Yeah.
I'm also happy if anyone has any specific questions, if you email me, I can go off and look at specific parts of data because I've given you very high level data.
Thanks a lot, Caroline, and thank you for your presentation. And we look forward to some of those points being made again by other presenters this morning. So thank you very much for that. And now we're really excited to introduce one of our keynote presenters, Laura Mesquita, MD, who's Director of the National Center of Elder Abuse in California. Laura is joining us today from Washington, DC, has stayed up especially in the evening to be with us. She's the Professor of Family Medicine and Geriatrics at the Keck School of Medicine at the University of Southern California, as well as Director of the US National Center on Elder Abuse. She's an absolute authority on elder abuse and the care of older adults. So we're very, very fortunate to have her with us this morning. And she's going to speak on understanding resilience from a life course perspective. So welcome, Laura, and over to you.
Thank you, Anne. I really appreciate the kind introduction and the opportunity to talk to you. Now, I have to say, I was very excited when Eris asked me if I would speak, and then they told me the theme was resilience, and I went, I really have to think about this, and it really sent me on a wonderful adventure thinking about the role of resilience in elder abuse, because I'm embarrassed to say I hadn't given it enough thought in the past. And then I really started thinking about it from a life course perspective. So what I'm going to do is spend the next 20, 25 minutes with you, giving you some of my thoughts about building resilience from a life course perspective. And we're going to be zooming way out after hearing, I think, the really interesting and important data that were being presented. I have to also say that I'm a great admirer of the work that is being done by Eris, and even more so now that I've heard even more about you. And certainly by the person who's going to be speaking after me, you have your own Dr. Sue Curl, who's one of the international experts and leaders in this area. So why don't we put up my slides, and I'm going to put you to the real test here of flipping through these things fairly rapidly. Let's go to the next slide, please. And we're going to be talking about, as I'm talking about resilience and elder abuse, I'd like for you to think about how does this tie into prevention so that older adults actually don't get abused or neglected, recovery, so that once somebody is abused, how do they recover from it, looking at the resiliency factor, and also how people deal with it at the time that they're experiencing it. You know, somebody asked, I think, a great question, which does the person who's abusing even realize that what they're doing is abusive? And I also wonder sometimes, does the older adult who's being abused even realize that they're being abused? Partially because of ageist attitudes that we have towards ourselves. And we'll talk a little bit more about that later. Next slide. You know, Erickson talked about these different stages of psychosocial development. Next slide. And what's interesting to me is that he, next slide, talked about, there we go, thank you, stop it there, these different stages of psychosocial development. And if I went ahead and I put these little numbers by it in terms of age groups from 0 to 1, 1 to 3. Now it starts to get longer, 3-year periods, 3 to 6, 6 to 12. Look, by the time you get to older adults, people over the age of 60, me, I'm 62 years old, we've lumped them all into one huge group of 60 years. And the wonderful Gene Cohen, next slide, said, something is wrong with this. We have to go beyond this sort of sense of despair that happens with aging and realize that we actually can become more creative, more innovative, and certainly more emotionally intelligent as we age. And that we don't stop our growth and development when we hit the age of 60. Next slide. So Dr. Cohen talked about things like these different phases that we go through starting in midlife. And he also, and I might have added a little bit of this myself, a little bit of information about what happens to us physiologically, that we actually know our brains, like our corpus callosum, which is the part of our brain that connects the left side and the right side, actually expands in midlife. And that this is often the time when we're really doing something and wanting to accomplish something. Next slide. As we look at the next phase, which he called liberation, and for those of you who know or are people in your 60s, boy, it really is a time of liberation, isn't it? It's a period of experimentation and innovation, a sense that we can try and do things that we've always wanted to do. And we also know that there are new neurons being formed, far from this idea that our brains just start to shut down as we age. Next slide. So the phase 3, what he called the summing up, is when we start getting into our 70s and 80s, is when you have a chance to look back and really reflect. What has mattered to me? What has been important? How can I give back? This is a time when many of us are involved in volunteer activities. Next slide. And then when we think about even the later stage, as we get into our 80s, 90s, and beyond, people are still creative, socially engaged, thinking about, what was my life like? What was my purpose? How did I do? How did my family do? What did I contribute to the world? What's important to me? And we really have found time and time again that what we call the oldest old, people over the age of 80 or 85, can cope really well. And in fact, have very high levels of satisfaction and psychological resilience. And in fact, are better at adapting to changing conditions. Even older adults who you might look at and say, wow, they've got a whole lot of medical problems. They're really unhealthy. But when you talk to them, they're often adapting beautifully. Let's look at an example in the next slide. And this was an example that Dr. Cohen used of Martha Graham, who was a remarkable dancer. And when she retired at the age of 75, she didn't just say, that's it, I'm hanging up my ballet shoes. She actually then turned to choreography. Similarly, the great pianist, Arthur Rubinstein, continued to play, but he began to have trouble going as quickly. His fingers weren't moving quite as quickly as he got into his 70s. So instead of just saying, that's it, I'm not going to do it, he played everything more slowly so that when he got to the fast parts, they still sounded fast. And I'll just also mention one of my patients who adapted beautifully. She was really into something called line dancing, where they had to listen to all kinds of orders that somebody was shouting and dance in a particular way, and her hearing started to go and she couldn't move as quickly. So she and her partner took up ballroom dancing. They didn't just say, chuck it, we can't do it. They really adapted well. Next slide. So why is it that some folks are more resilient than others? And this is where I really am interested in this life course perspective. Next slide. I found this really interesting article when I was preparing for this talk, looking at what happens to resilience even in our younger ages. And there's this direct correlation. Don't worry about all the data involved in this or trying to read this. Just be impressed by the slope of this graph. And what it shows is in adolescence, and this is across 26 countries, so it was a big international study, they found that those who had more family connections were flourishing. We are social animals as human beings for the most part. We need these social connections. And it is very clear when we look at studies like in America these days, something called ACEs or Adverse Childhood Experience Studies have really showed that the more adverse events you have as a child, the more health problems you have as older adults. And I'm really beginning to think that one of the best ways to prevent elder abuse is to prevent child abuse. Next slide. So if we think about things, we are really the makeup of our physical, emotional, social, and spiritual selves. Next slide. And where we're located is where all of these things intersect. But here's what I would say happens as we get older. Next slide. These things intersect much more strongly. So what's going on in our social and emotional lives have a greater impact on our physical. What's going on in our physical lives may have a greater impact on our emotional lives. And in understanding, and that's what I think is one of the wonderful things about ERAS is you get that, and really take a holistic person-centered approach to aging, which is marvelous. Next slide. So truly, the older we get, the more different we become. If you were to show me a room full of 2-year-olds, I can pretty well, I would say 90% predict what their function is like. But if you give me a room full of 92-year-olds, we're going to see an incredible variety of function. And so as we get older, in terms of our physiology, our psychology, our physical function, we become more different. And that's why I say heterogeneity is a hallmark. Next slide. There's a lot of changes that happen with aging. And this is just an example of some of them, right? In our musculoskeletal system, our bones become a little less dense. There's changes in our kidney system that really affects things like our metabolism of medications. Our skin becomes thinner. These are some of the changes that happen with aging. And because of this, we sometimes have a very dismal view of aging. Next slide. And that's why I think it's so important to talk about resilience. What does resilience mean? Let's take a minute to think about it. Well, it's this idea of I can recover quickly from difficulties. It's this idea of toughness. If you look at resilience as it relates to materials, it's the ability of something to spring back into shape, or this sense of elasticity. And it does involve these concepts such as mental toughness, the ability to protect yourself, withstanding adversity, bouncing back from adversity. And that's why, as I started to look into this more, I thought, what a brilliant idea to have resiliency as a theme for World Elder Abuse Awareness Day. So again, kudos on that. Next slide, please. There's a variety of types of resiliency, right? There's physical, emotional, social, and spiritual. If we want to go back to that biopsychosocial spiritual model. And we'll talk about how those change with age. Next slide, please. I'm also just putting in a few slides about some remarkable people. This woman at the age of 80 who was practicing karate, and she started at the age of 78 for mental sharpness. Next slide. I wouldn't want to mess with her. So does resilience change with age? Well, we got to be honest, right? I mean, as we get older, our bodies do become less resilient for the most part. Our cognition also does. Our social circumstances may as well, with losses of spouses, friends, etc. But our emotional resilience actually seems to increase with advanced age. And how we view and understand ourselves and others actually improves. And I'll give you an example of that in a few minutes. Next slide. This is another example of a remarkable woman who started running marathons at the age of 68. That was after she started jogging at the age of 65. Next slide. So why is it that older adults may be more resilient, particularly emotionally resilient? Well, accumulated life experiences that gives us different ways and a broader variety of ways of looking at the world with these different experiences, a deeper understanding of human behavior, certainly more self-awareness as well. Next slide. So sometimes we talk about this concept of optimal aging. Some people talk about successful aging. I don't really like that term. there's too much stuff I have to be successful at. I don't want to fail aging. So I'm going to stick with optimal aging. This is a picture of one of my patients who decided to celebrate her 90th birthday by going skydiving. We are now in conversation about what she's going to do when she turns 100, which is coming up in the next few months. The idea of optimal aging is, can you function across many domains and enjoy it so that you're satisfied? And oftentimes when I'm talking to my patients, it's not so much about happiness or sort of that ecstatic joy, but more about contentment and that inner joy. So are you able to function to your satisfaction, despite the fact that you may have a variety of medical conditions? And that's really what we're working at when we talk about optimal aging. So one time I did this little thing with a friend of mine. I asked a whole bunch of my patients, what's it like to get really old? Next slide. And I asked them to write down, and these were all people over the age of 85, what the experience was like to get really old. And next slide, here's some of the things they said about some of the difficulties that my beloved's passing left me lonely, knee pain, I can't drive at night. Somebody wrote the saggage. It was hard to read her writing. I mean, do you mean baggage? She said, no, dear, I mean saggage. I said, okay, I gotcha. Time-consuming doctor's appointments, all these sorts of things. Next slide. And then I said, well, let's look at it a little differently. Can you flip the switch here? Don't worry, no kittens were harmed in the making of this slide. Can you look at it the other way and tell me about some of the positive things? And here are some of the things that came pouring out in our next slide. I feel free to be more candid, more accepting. I'm more deeply appreciative of connections and friendships. I'm not competing as much as I used to. My kids see me as more than a pancake maker. I'm more reflective and spiritual. Next slide. People also talked about being more mindful and in the moment and really enjoying some of their accomplishments that they could look back on. People talk about these bursts of creativity, referencing back to some of what Dr. Cohen had written about. And this idea really that gets to resilience, right? I'm strong at the core. I've survived a lot, and I'm going to continue to survive as I move on. Next slide, which is why many older adults really achieve wisdom. And some of the ingredients of wisdom are this curiosity and a continued interest in learning, the ability to have critical thinking and call younger people on things when things don't quite make sense. The ingenuity and social intelligence and perspective. This is stuff that you don't just get in book learning, but that you really get through experience. And if you're really doing well, sometimes you can even go beyond wisdom, next slide, and achieve some sense of transcendence. The true appreciation of beauty and excellence that's all around us, noticing that with gratitude and hope, maybe deepening your spirituality, which doesn't have to be a religious type of spirituality, but that sense that we're all connected and belong to something bigger than ourselves. Being much more quick to forgive and have a sense of humor, not just about the world, but about ourselves as well, and still having a real zest for life. Next slide. My last slide, by the way, it's not this one. Don't get excited. You still have a little bit more with me here that you have to put up with. But my next slide is I'm going to show you my favorite example of somebody who has a zest for life. So stay tuned for that. The idea about building resiliency across the lifespan, I have to quote one of my favorite singers, songwriters, poets, and that's Leonard Cohen. The idea that there's a crack in everything, and that's how the light gets in. And let's talk a little bit about ways to contribute to resilience in old age. Next slide. And next slide. One thing that we can do is we have to, we'll go one back, please. Thank you so much. We have to think about, and not just think about, but recognize and rectify our past failures, whether it's attitudes, biases. You mentioned stolen generations earlier. We have to own up to this, and we have to acknowledge that it's had an impact on somebody's life throughout their life, and certainly in old age. Next slide. We have to, I think, start early. As I mentioned a few minutes ago, I think maybe the best way to prevent elder abuse is we've got to start by preventing child abuse. not pit the generations against each other, but help us understand each other and contribute to each other's well-being. Next slide. I think we have to really appreciate the life course perspective, be it intergenerational activities, be it understanding and appreciating that we move through life in different ways and hopefully gain some of this wisdom and transcendence that I spoke of a minute ago. Next slide. And we clearly have to respect our elders. Some of the people speaking before me spoke eloquently about ageism and the importance of ageism. And certainly my patients experience it and talk to me about it regularly. And what is ageism? Ageism is a prejudice against our future selves. It's one of the silliest biases that we have. And I think that folks in Australia are doing a remarkable job and really leading not only nationally, but internationally in understanding and addressing issues of ageism, which clearly contribute to concerns of elder abuse. The more we can say old people are not me, old people belong over there, I'm not one of them, we don't own up to the fact that we hope to be one of them, and we still talk about us and them. The fact that we don't appreciate what all older adults have to offer, whether they're cognitively intact or in an advanced stage of dementia, they're recognizing the humanness in each other is critically important if we want to prevent elder abuse. Next slide. So as we think about prevention and recovery in dealing with an abusive situation, it just brings me back to your brilliance to coming up with talking about resilience as a theme and pushing me to think about it differently and more deeply. I do think that ARAS is to be congratulated on the remarkable work that you're doing and to again acknowledge that you're both a national and international leader, not only in serving older adults, but in empowering older adults, which I think is another key important way to prevent abuse and neglect. And I'm going to now show you my next slide that I teased a little bit earlier. And this is a slide of my wonderful mother-in-law, who will be turning 91 very soon, being completely loved by an adorable little puppy. And this is a woman who has an absolute zest for life. She has some serious medical problems, but just returned from New York City, which was the first time she'd ever seen it in her whole life. And I think she's somebody who really exemplifies resilience, wisdom, transcendence, and grace. So it's a joy for me to share a little bit of my family with you. It's a joy for me and an honor for me to have been invited to speak to your group. And if there's a few minutes, I'm happy to take questions. And if not, I will bid everybody a fond farewell.
Thank you so much, Laura. I love the positivity of your presentation and your focus on emotional resilience, I thought was really interesting. So we have got time for just a couple of questions, and there's a couple that have come in. You talked about emotional resilience. There's a question that's come in. What does, and this is tough stuff. What does resilience look like for older women who have been sexually abused in aged care?
I'm really glad that that's been asked, because I think one thing we want to be very careful about is that we don't blame the victim. So that we don't say, well, you weren't smart enough, or you didn't dress appropriately, or you whatever, that it's not your. So we have to be very careful that we don't blame people who've been abused or neglected in any way, even if we understand it might be a stressed caregiver, and certainly not understand in the case of a sexual assault. So I think what resilience looks like there is what has this person's past experiences been like? When have they responded with strength, and where do they find their strength? And how can we, with a trauma-informed sort of perspective, help them find that to recover from a really horrible event?
Mm-hmm. Thank you, Laura. The other thing I was thinking about is you talked about the importance of family and connections to help people flourish. And we had an earlier question from Christy saying, how can we prevent carer burnout? Because carer burnout often can cause neglect or abuse through that burnout of situation. And with COVID here, as I'm sure you've had in the States, carer burnout is really, really common. And yet those connections you're saying are so important. So what can you do for carers?
Right. So I think depending on what role we're in, and I know we have a lot of people who are direct care service providers, it's really helping people think forward about things. You know, I think we've, at least in the United States, we tend to sort of beatify caregivers. You know, we put them up on a pedestal and we don't give them permission to talk about how difficult it is. And I think giving permission for people to talk about what it's like and the difficulties they're going through, to acknowledge that. And then what we want to do is identify these things at an early stage. And again, we don't want to say, well, that person got neglected or abused because they were just impossible. It was too hard to care for them and this caregiver meant well. That's still not good enough. For the older adult, they're still getting abused. I do think, though, it's important for us to understand where the caregiver is coming from, because the vast majority of people who end up abusing are not evil people who need to be locked up. They're people who've lost control. They may have their own reasons, some of which we might be able to help them with, or sometimes they're just not appropriate or emotionally equipped to be a caregiver. So I think asking the question and giving space privately. So in my own practice, where I care for a lot of people with dementia, I might talk to the caregiver separately. While I'm in the room with the patient and the caregiver, though, I'm looking at their body languages. They're kind of like, and you can see they're correcting their mother, for example. And so I'm already getting a sense that there's some tension. And then I separate them and I ask the caregiver, I can see that things are pretty stressful for you. How's it going? Very open-ended. And I think one of the biggest difficulties for all of us as busy clinicians and care providers is to provide that sense of comfort and safety, that it's okay to talk to me about this because I'm here for you and I want to help.
And talking about it, it seems to me to be a really important strategy. And it's okay to talk about it. And it's okay to feel burnt out and talk about that and look at ways, you know, to recover.
Yeah, you're so right. And I'll ask people direct questions. Have you ever gotten to a point where you're yelling, or have you ever hit? Have you ever hit your dad? And I'm very direct about it. But hopefully in a compassionate, empathetic way. But I'm not I'm not subtle about it. And I will ask my older adult patients, is anybody hurting you? Are you afraid of anybody? Is anybody using your money without your permission? So again, very direct questions.
Yeah. Thank you so much, Laura. We've learned so much from you this morning. So thank you very much for being with us. Thank you for staying up in late in the evening in Washington. I hope that your work goes well for you, and we'll keep in touch. It's really important.
Thank you very much.
So thank you very much indeed. Goodbye.
Bye-bye.
Next, everybody, it's my great pleasure to introduce Professor Susan Curl. Sue is a geriatrician and a clinical academic and has a long-time interest in elder abuse. Now she's on the screen, her face might be quite familiar to you. If you've been entranced as I have been with her International Emmy Award winning ABC series, Old People's Home for 4-year-olds. Really interesting then that we just had Laura Sue talking about child abuse and that connection. I'm sure you'll pick up on that. So Sue is going to talk to us about older people and resilience in turbulent times. So over to you. Thank you, Sue.
Thanks, Anne, and thanks for the opportunity. I hope my presentation's going to come up now because the first slide is particularly for Laura Mosqueda. Laura, do you remember meeting this particular quokka on Rottnest Island when you were in Australia, I think for the AAG conference, gosh, 13, 14 years ago? I just had to put it up to show you that we still think about you often. So next slide, please, which is actually, yeah, my title slide. Look, when I saw the theme, like Laura, when I saw the theme of resilience, I thought this is absolutely perfect. Resilience in older people has been front and centre over the past 2 years, and tying it in with elder abuse, I thought was really wonderful. I'm going to use the events of the last 2.5 years to give examples of resilience with some reference to elder abuse, which obviously is the reason we're here. So next slide, please. I want to take you back 2.5 years. I work down the south coast of New South Wales. And in fact, the photo on the left is taken very close to the little cottage that I have down the south coast, which is one of the reasons I work down there and do outreach clinics. I was there right through those fires from December to January for the simple reason that we couldn't get out because all the roads, or the 2 major highways, were closed. So next slide, please. Just to give you a few details about the South Coast, because I'm going to mainly rely on my experience with my patients down there rather than my work as a geriatrician in Sydney. So Eurobodalla Shire, it's about 300 kilometres south of Sydney. It's a retirement area. In fact, it's where a lot of people from Canberra go to retire because it's the closest beach to our national capital. Median age is 52. 35% of the population are over 65. And when you hear that 1 in 6 figure in terms of elder abuse, you think, yep, we've got quite a few people, older people in that category. But I'm going back to the fires. The Currowan fire, which is what it was called, started as a lightning strike in remote bushland, and nothing was done about it, as we know. And it moved south from mid-December. It resulted in major property damage in that southern part of New South Wales, road closures, lots of property damage, and 7 deaths. The fire around Bateman's Bay on New Year's Eve destroyed hundreds of houses, forced thousands to evacuate, and when you think 35% of those people were over the age of 65, it's important. There was quite a bit of evacuation from one aged care facility and one retirement village. They realised that you couldn't evacuate a lot of those other older people, so instead they protected. The power went out for more than a week, telecommunications went out for several weeks, and we went back to car radios being the best means of news. So next slide, please. So how did older people cope? And these are just some photos from those 2 days. So the car park at the left is the evacuation centre. The middle photo is taken from just inside an aged care facility, and we can see the rural fire service hosing down the trees around it. It was quite incredible. They got all 120 residents into one part of the facility, pulled the curtains, and basically prayed. The rural fire service were fantastic, and the facility was fine, but they lost everything around the outside. Bottom left is one of the evacuation centres, but a lot of people went to the beach, and that's the 2 photos on the right. And it was absolutely incredible. Having been there, I understand the incredible feelings that people had of danger. Next slide, please. So coming back to how did older people cope? And I have to say, it was incredibly positive. Most older people coped amazingly well. I continued to do clinics during this time because we kept the hospital running because, of course, we had our own generators, so we could. And it was nicer to work there than elsewhere. But many of my older patients and others said they'd seen much worse in their lives. And that lovely saying, this too will pass, because they'd lived through other bushfires, other calamities, and some of the lovely things for people who were very young when it was Second World War was this is nothing like the London Blitz, or not as bad as Darwin in World War II when the Japanese attacked. Many of my older people said there were other people worse off than they were. But what was lovely was the way the community pulled together. The GPs and the local pharmacies made themselves available, even though there was no power. And so they couldn't do any credit card transactions. They ran clinics in the evacuation centres for free. Neighbours made sure older people had sort of food and ice because it was pretty hot and very smoky. Community services arranged trailers that had showers and laundries in them so people could have a shower and wash their clothes. And anyone that had a generator let people charge up phones. I'm a doomsday prepper. I have 2 generators. So when our power went out, we were okay. I also have a pantry full of food, much to my children's delight, because this time they understood why, and cash. You have to have cash because none of the electronic funds transfer worked for at least 2 weeks. Next slide, please. It was a lesson for all of us. And as an older person myself, I was very glad we prepared. There were some negatives. Older people with dementia didn't cope well. They didn't understand why they had to evacuate. And it was very difficult because we often had to use police or ambulance to get them out of their homes because they were in danger. Unfamiliar setting, the surroundings in the evacuation centres, which were usually gyms, school gymnasiums. It was quite interesting. And older people did find sleeping on the floor because we didn't have beds everywhere. Sleeping on the hard floor was no fun, and particularly if they had to get up at least 5 times a night, as many do. Next slide, please. The question lots of people asked is, why did older people cope better than younger people? How did they bounce back so well? And we come back to that, the adjectives that Laura was using in her talk to describe resilience, and why they had that resilience. As they would say, years of survival and coping and life experience. They had that in spades, and it gave them confidence in their ability to adapt. They had the glass half full attitude, and that was really important. There were a few people that were very negative, and I would have to say they disappeared to big cities and I don't think ever came back. A lot of older people, because they were well prepared, they had pantry supplies, a bit like I did, and they had their go bags ready, so they felt in control. And that in control feeling, I think, is really important. Just a couple of examples of resilience. One of my patients, one of my oldest ones, 104, bought a new house after hers burnt down. She was very quick to buy it. She got in fast, and I believe she was the oldest home purchaser in the state of New South Wales. Another of my ladies, she was 89. She spent 2 nights in her car because she didn't want to go into the evacuation centre with her cat. And she laughed about what her great-grandchildren would think. Despite their age, a lot of older people saw fires as an opportunity to plan for the future and move or rebuild. They saw the positive side, not the negative. And so many said the community has come together in a way that they haven't seen for years. It was a difficult time, but there were many positives. And I think those words, resilient, in control, bounce back, all those words we heard often. Next slide, please. And then we had recovery. And watch how those devastated, that thousands, hundreds of thousands of acres of bushland, you know, how they've recovered is quite amazing. Next slide, please. And we thought we were doing really well. And then along came COVID. Next slide, please. That, I guess, was the plague that followed the fire. We know about the repeated lockdowns and how they reduced social activities, shopping and doctor's visits, which were often the older person's only social outings anyway. They were curtailed. Initially, where older people received services, those carer visits stopped. We had that dreadful fear of COVID initially. And we certainly saw a lot of older people who developed malnutrition. They had falls, they became depressed, they had poor personal hygiene. In a number of cases where they were very dependent and living at home, we also saw it in residential aged care facilities. We'd have to say telehealth consultations have brought real changes in healthcare. Electronic prescribing has improved access to medications, but the face-to-face contact that so many people value is missing and is missed. We've certainly seen a lot of cases of neglect, financial exploitation and probably other forms as well, but the neglect was evident because a lot of service providers literally ran for the hills and family carers were scared or reluctant to come in. And this was where neighbours stepped in. Next slide, please. I think the involvement of neighbours has been amazing. I just want to give you one example, again from Bateman's Bay, where I work, a town of 17,000 people. They had an outbreak in their Soldiers Club, which is really the major social club in the town. 8 people got COVID. It was amazing. Within about 3 hours, the whole town voluntarily locked down. All the shops except the supermarkets and the pharmacies closed, and there was social distancing and mask wearing. And this is early on, 2020. Neighbours checked on older people. There were queues up to 8 hours for testing because everybody was really concerned about this. And there were, I think, 3 more cases in children, and then the cluster finished. Next slide, please. But it gives you an example of the community pulling together to address an issue, and it worked well. My big concern with COVID was and has been and continues to be that residents of aged care facilities are very affected by it. Lots of excess deaths due to COVID, but also due to lack of support from families and volunteers because they were locked out, and lack of services because aged care providers could not provide the staff. And we saw that where people were, in some cases, left for days without any support. What really concerned me was a number of our acute hospitals denied access to acute care for aged care residents because they said, oh, they can be looked after in their aged care facility. Well, no, and that's certainly the subject of a coroner's case coming up soon. I guess COVID really highlighted the inadequate care that was already being provided pre-COVID by many aged care organisations who really put their profit way ahead of care, and that really came out of the darkness into the light. However, there were some positives. A few organisations were prepared for the pandemic and developed what we call partners in care programs, allowing family carers to visit and provide care as essential carers right through lockdown. I know all about this because my mum was in one of those facilities. I did the Partners in Care program, and I was able to visit right through all the lockdowns, except when there was actually another case in the apartment where my mother was. Other than that, I could visit between 10 and 4 every day, and it used to upset me so much when I'd hear about so many old people who were still isolated. This organisation had been proactive. And despite the fact you could do the Partners in Care program, a lot of organisations kept families out for a long time. Next slide, please. And this is despite there being very clear advice that you could have them in. So how have older people coped? We've seen the effects of COVID. We know a lot of older people were isolated prior to COVID. And lockdown worsened this. However, social isolation and loneliness are not the same. And a number of my older patients, both down the coast but up here in Sydney as well, would say they're not lonely. They're happy with their own company. They've got their home, their radio, their garden, their pets, their telephone. And lockdown wasn't a huge issue, except in terms of particularly shopping. What was interesting is a number said they found inner strength when faced with lockdown, and they found they could rely on their own resources. Many commented on finding different ways to communicate, and a lot said it was wonderful the way the neighbourhood came together. And they felt much more positive about the future as a result of that. And I would say everybody has expressed gratitude for the support that's been provided to them. Next slide, please. By family, by neighbours, sometimes by strangers. Quite amazing. We are still seeing now, and we must remember, COVID is not over. We're still having 18, 20, 40, 50 deaths a day from COVID. It is still here. I know, because in our hospital, we're still admitting cases of COVID. We're still seeing cases of neglect from residential care, but also from home. Some just recent examples in the last 3 weeks: pressure injuries, weight loss, malnutrition, and immobility due to being kept in bed. We know some older people have been financially exploited, and just one example that over the last 9 months of a lady, Mrs. B, lived alone, independently. Son moved in during COVID about mid-2021, took over her life. He told her she couldn't look after herself. He was sort of gaslighting her, telling her she was hopeless, that she had to stop driving. He actually put dings in her car and said, see, you're running into things, you can't drive. He wanted her to move to care, but the final straw was when he said he wanted her dog put down. That, she said, that was it. She stood up to him. Her words were, I found my backbone. And with the help of neighbours, GP and geriatrician, we got her to a solicitor. We had the son evicted and an AVO put in place. She's had ongoing support from her neighbours and services, and she said, it's wonderful. I've made so many new friends. And she thinks she's coped well because of past experiences, good and bad, and seeing the glass half full. Next slide, please. So we actually thought good. Lockdowns decreased. You know, Christmas came last year and everyone breathed a sigh of relief. Next slide, please. And then along came the floods. Now, there were floods in northern New South Wales and southern Queensland. These were the floods around where I work down the South Coast. And these are pictures from Moruya, Mogo and Bateman's Bay. And you can see water inundated everything. Next slide, please. But once again, older people coped amazingly well due to their resilience, their past experience, and I guess their ability to cope with whatever life was going to throw at them. And everyone helped each other. Some lovely examples were one of my, actually the wife of one of my patients, 82-year-old lady, she turned her barn and garage into a pet refuge. And she had dozens of animals that from the lower lying parts around Moruya. She had pigs, goats, cats, chickens, dogs. She had, I think, a couple of small horses as well. Another example was a couple in their late 70s who cooked bread and scones for more than 50 families who were inundated during those 2 weeks. He was the husband's son, the couple's son was a baker, so they had lots and lots of flour which they couldn't use otherwise. And just another example, when someone stupidly crossed the creek, got their car stuck, the local farmers came out. Again, the community coming together. Next slide, please. It was, I guess, those 3 examples of turbulent times show that we do breed tough people. They were difficult situations. It did make the community very aware of the needs of vulnerable people, but it showed how we could work together to support older people to maintain their independence. But in return, older people have demonstrated their resilience and their ability to stay in control. And again, we've heard the words that Laura used, the bounce back, in control, ability to adapt, all part of resilience. But all this has engendered quite a degree of respect in younger people for older people. And Laura's comments about ageism, I think this has really addressed ageism. I'm aware of it certainly in the community where I work down there. And I think these are really good lessons for us. Prevention, dealing, recovery of elder abuse. These are wonderful lessons for us as we develop our community response to other difficult situations like elder abuse for our older people. Thank you. And that's the next slide, I think. Thanks.
Thank you very much. So sorry, I'm getting an echo. I think we're right now. Thank you very much for that. It's such a positive story, isn't it? Having been through fires, COVID, and then floods, how communities can come together. Do you think that sense of community connection will persist in those areas?
We wondered that after the fires, and then COVID came along and it all happened again. And then we thought, oh, it'll settle down. And then the floods came. And they've really only just 2-3 months ago. And people responded again. I think we're learning those lessons. Certainly, just talking to the man where I fill up with petrol, his comment was he's amazed at the way all his older customers have managed, and he wants to become one of them. And I thought, you know, he's in his 50s. But Laura's comments about ageism being prejudice against our future, that's so important. And this particular man in the petrol station just said, you know, I want to be like that. And I thought, that's amazing. That's someone from the community having observed how older people coped, I think was wonderful. My hope is we will maintain that sense of community at least for a while. And we'll see what comes along next in terms of, I'm not sure, are we due for the plague? Maybe it's, I know we had mice. We did have mice. I know they ate all the rubber off the wires in our car. There's certainly, we'll get something. But again, it's working as a community when you've got, if you like, a common adversary. It is lovely to see the way people pull together and learn to understand each other. I think that's what's really been very clear to me.
Yeah, so, you know, I was thinking when you were talking as well, it's about when you said that there's respect from younger people about older people, it shows us how important it is that older people are part of communities and not isolated somewhere out, you know, in a village or something where there's not that mixing, because the respect grows, doesn't it, through those connections. And it links with, I'm just going to talk about a question that Diana asked. So her question was, what strategies do you think might be employed to build resilience in those without a family? So you've talked about the community, families and communities joining together and helping each other. What do we do for the people who don't have that around them?
That becomes very difficult. Sometimes they don't actually want that help.
Yeah.
And that's quite interesting.
Yeah.
I do have experience with a couple of people who really wanted nothing and still don't want anything, even though they're struggling, because that's how they are. But I think we have to look out for all our others. And I just want to bring up, going back to ageism, you mentioned earlier our wonderful series, Old People's Home for 4-year-olds, the way that getting 4-year-olds and older people together has reduced the ageist attitudes of 4-year-olds. Let me tell you, series 3 is called Old People's Home for Teenagers, and it's in post-production at the moment. And again, we are seeing a change in attitudes, which I think will become very obvious on the screen. I don't think it's as cute as our first 2 series, but it really brings up how you can address ageism in the community by bringing older people and younger people, that intergenerational idea, by bringing them together. And that is another way, certainly, we can be addressing abuse, by getting young people aware of what does happen with older people, because they wouldn't believe it if you told them initially.
Thank you, Sue. While I've got you there, there was a general question that somebody put forward when they registered, and I thought you might be a good one to ask this question. So it's a more general question, but it says, when is the right time to call in the experts and what is the best way to do this? So with your practice, I thought this might be a good one to throw to you.
Look, yeah, I think it's a really good question. My answer would be when the victim asks and when the victim gives you consent or permission. I think that's really important. The number of times, although I suppose I'm already called in, but I can't do anything unless the person's happy for us to be involved. But I would note that if the person's really at risk of harm, or if there's a criminal act happening, then we really have no choice. You have to go in there and then. But other than that, I think it's really important. As Laura mentioned, the abusers often aren't bad people. It's not a criminal situation quite a bit of the time. So it's important to go in very carefully so you don't destroy the relationship that's there. But it's being asked and being able to reassure them that you'll do, you'll try and keep family intact where you can.
And all the time, I imagine, sort of building the victim, as you call them, sense of control and agency and respecting that.
I think that's really important, that respecting if they don't want anything done. And then we'll talk around, well, maybe we could just do this or do that, because you don't want to override them. If they're able to consent or deny consent, then I think, we really have to respect that. But we have to let them know we're not going to walk away. We'll still be there if they decide they would like help, and we might just pop in and see how things are going.
Beautiful. Thank you very much, Sue. And we really look forward to your next production with teenagers, connecting teenagers with older people, which is wonderful. Thank you for your work. Congratulations on it. And it's been lovely to have you with us today. Thank you very much. Goodbye. So now we'd like to acknowledge Dementia Australia. We've been talking a little bit, Sue talked a little bit about dementia. Dementia Australia is one of our champion sponsors. And Kylie Miskovsky, have I got it right, Kylie? Is General Manager of Policy and Advocacy, and she'll be speaking on behalf of the organisation. So welcome, Kylie. Kylie has been with Dementia Australia for 11 years, and she's worked in various research and policy roles in that time. She's got an honours degree in social science. She's a passionate advocate for people living with dementia, their families and their carers. So over to you, Kylie.
Thanks, Anne. Hi, everyone. Just like to acknowledge that I'm joining you today from the lands of the Bidjigal people of the Eora Nation in southern Sydney, and I pay my respects to their elders past, present and emerging. Thank you to Aris for inviting me to speak today. I'm really happy to be here to support World Elder Abuse Awareness Day online forum and the really important messages that are being shared today on building resilience. So as you may know, Dementia Australia exists to support and empower the estimated 500,000 Australians living with dementia and the almost 1.6 million people involved in their care. Dementia Australia was founded by carers more than 35 years ago, and today we're the national peak body for people impacted by dementia in Australia. People living with dementia are at an increased risk of elder abuse due to their cognitive impairment and dependency on others. And as Sue mentioned, the COVID-19 pandemic has exacerbated this risk. With the numbers of Australians living with dementia expected to increase to almost 1.1 million by 2058, the risk of being impacted by elder abuse is an increasing concern. It's critical that effective safeguards are in place across all states and territories to protect people living with dementia from elder abuse and ensure that they are treated with the same dignity, respect and rights as everyone else. While the issue of elder abuse has risen in profile, I think in part to the work of the Royal Commission into Aged Care Quality and Safety, the momentum for change can't be lost. We need improved levels of dementia knowledge through training, education and support for people who are working with or caring for someone living with dementia. And this is needed to minimise the risk of abuse. And this can help to ensure that the identification of any changes in behaviour which could signal something isn't right for a person living with dementia. So a tool that could help is Dementia Australia's Ask Annie, and this is a mobile app that offers short self-paced learning modules to help care workers refresh their skills and learn tips and tools to provide better care for people living with dementia. This week, Dementia Australia, in partnership with the IOOF Foundation and Insignia Financial, released a new education model in the Ask Annie app to improve all care workers' knowledge on financial elder abuse. This new free module aims to improve care workers' knowledge through a series of animated scenarios that explain what financial elder abuse is, how to recognise the signs, and strategies to prevent or report it. Ask Annie can be downloaded via the Google Play Store or the Apple App Store, and I encourage you to download this app if you think it could be helpful in your work. Thanks again for the invitation to speak today, and I look forward to the rest of the forum.
Thank you very much, Kylie. So we've got Ask Annie on our brains now, and I'd encourage everybody as well to have a look at that tool with tips and tricks, really useful. So thank you very much indeed, Kylie. Thank you for sponsoring the session today, and thank you for your presentation. So now, everybody, we've got a very special treat. We encourage you to sing along, to dance. If you've been with us for the whole morning, it's time to get up and move around a bit, grab a cup of tea, and we have our very own Julie Caritas, who's a staff member here at ARIS, who's going to introduce this next piece for you. So Julie, welcome, and over to you.
Thanks, Anne. Nina Marnie, everyone. My name is Julie Caritas and I'm the Aboriginal advocate at ARIS and also a proud Gamilaroi woman. The Deadly Nanas are a group of elder women who perform songs of inspiration, culture and language. The group are made up of mainly Aboriginal women, but there are 2 non-Aboriginal women in the group who support each other to stay strong, stay safe and stay connected. I just need to advise that our Aboriginal and Torres Strait Islander participants that this video clip contains names, images and people that may have passed. So I'd like to introduce the Deadly Nanas singing Celebrating Culture, Nucken.
Sorry, you probably couldn't hear me, and I was talking about how wonderful that was and hoping you were singing along and dancing and moving around a bit at that time. So next we have Natasha Short with us. Natasha is the Managing Director of Kimberley Birds. So I hope you watched the Deadly Nanas, Natasha, and we're singing and dancing along with them. So Natasha is a descendant of the Jaru people of Halls Creek, East Kimberley, and she's passionate about social justice, as you'll hear, and Aboriginal affairs. She's been a really strong advocate for disadvantaged groups and is just so enthusiastic and positive about her ability to affect positive change, which is hard to keep up that positivity. So we celebrate you, Natasha, for being able to do that. So Natasha's going to talk to us about a project on No More Humbug. So over to you, Natasha.
Thanks so much, Anne, and G'day Jilanda, everybody. That's good day. Obviously, Anne's just introduced me as a Jaru woman, which is 400 k's of where I'm sitting right now, which is Kununurra in the East Kimberley. And this is actually the land belonging to the Mirrawong people. And I've pretty much grown up in Kununurra all of my life. And I have set up my business, Kimberley Geargas, or Birds, in Jaru. In 2018, it's a 100% Indigenous controlled consultancy agency, whereby we're providing dozens of services into our communities to better the outcomes of our people on the ground, but also very much in my mandate is to empower women and to raise the voices, amplify the voices of Kimberley Indigenous women. And we are a collective of Kimberley Indigenous women influencing social change. So back in 2020, Kimberley Community Legal Service, KCLS, which is a regional body here in the Kimberley, had approached my business to say that they had been experiencing elders coming into their organization to request support for financial assistance. And so when they dug down into that a little bit more to ask what was going on, why were people requiring food vouchers, etc., they began to realize there's an exploitation happening here of older people within our region. So they commissioned me to do a 6-month piece of work that was Kimberley-wide to basically talk to stakeholders, individuals, and focus groups in regards to elder abuse. And when we talk about elders here in this situation, we basically did the report from a 50+ perspective, even though we don't necessarily call a 50-year-olds elders for the purpose of this report. That's who we were targeting. We then conducted 6-month worth of conversations around just our region to have this conversation. And basically what we found was that this was something that was very prevalent and taking place widely across our community. So when we went and spoke to people, they were not unawares, or it wasn't a new thing that we were discussing with them. They said it is so normalized, no one thinks anything about it. So it's basically been going on for so long and is taking place so commonly that no one's really seeing it so much now as an issue, even though, of course, they know it's an issue. Now, going on the 2016 census data, there's approximately 35,000 people that live in the Kimberleys. 40% are Indigenous. We have multiple language groups across our region, so we don't just have 1 or 2 languages. We have many, many languages across the place. So we were very fortunate to encompass many, many views and collect the voices of many languages into this particular piece of work, which was then released in December 2020. It's now 18 months old as a piece of work. There are multiple resources that were created out of that piece of work. And we're now waiting for the next stage for the implementation of these recommendations that we're basically making in the report. So to go back in regards to the findings were that, yes, it's there. It was one of the hardest pieces of works that I've done, in the sense it was so emotionally taxing to hear all these horrific stories of our elders basically being abused. And this report, by the way, focused on financial elder abuse, and we were about trying to reduce financial elder abuse in our communities. Of course, there are many forms of abuse of older and vulnerable people, but in this case, we were dealing with finances because that's what KCLS were encountering as people were coming in asking for food vouchers, et cetera, et cetera. So the findings were, yes, it's there. Why is it happening? Basically, a lot of it is simply common sense, right? So older people are vulnerable. They are needing their families. They don't want to be in the bad books with their families. They also love their families. So they're never going to report their families when these things are going on. They're basically an easy target. You then also have the cultural perspective whereby many of these people, 50 plus in our communities, are people from a different generation whereby it was the Wurnan system. It was the caring and sharing and basically working as a collective. So sharing of resources and basically supporting one another to survive as a society, not only just survive, but thrive. So that sharing is deeply embedded in the psyche of our older people. So they would simply give to the point where they literally had no food left in the house. So cultural obligations is a big one. There was an overall lack of financial literacy. So our older people also were working for rations back in the day. So money is a fairly new commodity. It's a fairly new substance that people don't really have a lot of experience on managing and working out and knowing how to budget, etc. There's a lack of technology. So older people were relying on their family members to come and draw money out of the ATM for them, for example. They obviously need their family, love their family, and they're also not wanting to be lonely. So they're willing to put up with a little bit of nuisance. And when we say humbug, I think most people would know this is humbug means has a negative connotation, right? It means you're harassing me for something and basically I'm giving it to you in the end so I can have some peace and quiet. There's going to be no return of the $50 that I'm giving to you. I just know that I need to give it to you because I need a break from you. So even when people do want to say no, they're hounded and humbugged for so long, they basically just give it up just to have some peace and quiet. The perpetrators that we found during our research piece was basically predominantly immediate family. So sons and daughters, grandsons and granddaughters. So immediate family and trusted individuals that older person would be very closely connected to in their everyday life. And we really truly have seen some and heard some incredibly abusive stories that has been happening and continues to happen across our region to this time, which is enormously sad and tragic and upsetting for people like myself, because we know the value of our elders, and in a traditional context and setting, elders would never have been treated in this manner. But because we have a breakdown in our society, we have chaos, we have substance abuse. That was also a big thing. So the perpetrators were family, and much of it was driven by substance addiction, namely alcohol and or drugs. So those things being required, people would go to the most easiest target, the most vulnerable cohort, and that's the elderly person. And that's also, of course, the relationship is one of trust and love, so and easy access. So people, if they want to conduct criminal activity, they're just going to go and get it in the most easiest form they can. So the recommendations that were in this report that we put together was basically a widening of the education campaign and really, really putting it out there to everybody that we know this is going on, and to try and get more people not turning a blind eye to it, but basically being aware of it and supporting people as much as they possibly can. All right. We thought that it would be important for stakeholders to come together and have a conversation about what could be done as a unit, as opposed to working potentially in silo groups. If you've got clients that are older, how can you possibly support one another to get that support to that older person? We would also love to see older people having access to financial literacy and technology literacy as well. we'd like to see an investment of extra funds into aged care services. And the other important one is for staff to be trained accordingly. So this is the work, this is the report I'm speaking about here. It's the No More Humbug, Reducing Financial Elder Abuse in the Kimberley. We also created posters. We've also created animations and the training manual, the staff training manual for people to be able to identify, because what some people were saying was, I don't know what is culture and I don't know what is abuse. Where is that line? So it's trying to help people have the confidence to be able to know I can rightly divide what is actually happening here and then accordingly support that older person to be in control of their finances. So we saw a lot of our older Aboriginal people paying all the bills, for example. Well, because we have overcrowding. So you might have 10, 15 people living in one house, but you've got 2 people basically paying all the bills for that household. So that's a form of abuse. The other perpetrator of abuse as well was actually merchants. So businesses who are exploiting vulnerable people, that's Aboriginal people and older people as well, and through a system called that centre pay, whereby people were constantly in a state of centre paying all their monies out to various suppliers, businesses, whether that's a butcher shop, whether that's a clothing shop, whether that's a toy shop. This sort of business was going on. So it's something that really does need to have some attention, some bigger investment of time and resources and energy into the space. Like I've said, this was released. It was basically a first of its kind report back in 2020 in December when we released it. And since then, nothing particularly has happened with it. And because people know that I did that piece of work, they'll call me even now and say, I'm witnessing a financial elder abuse situation. What's going to happen with it? So people who are in charge of portfolios for seniors and for older Australians really need to take some leadership in this space and work out how some real practical help can be given to people on the ground. Those resources that, and I really do commend and thank Kimberley Community Legal Service for their leadership in this space, because it was them really who saw that firsthand abuse that was going on and did something about it and received funding from the Attorney General's office to be able to engage my business to do that 6-month piece of work. That's been done. What's the next step? So those resources can be downloaded. They are free to use. You can use them at your will, as at your convenience, if they're of any relevance to you in your communities. Like I said, you've got the 4 pieces of work: the report, the posters, the animations, and the training manual. So you can download that now. You can use those freely, and please do that. And please work with as many people as you can to unite for change in your communities concerning older people. I think what I would like to say is, you can spoil a child by giving them too much. You can spoil a child, but you can never spoil an older person. You can only honor them. And I would love to see not only an investment of funds into the area of supporting elders, but initiatives whereby our older people are being honored and respected, and their knowledge being absorbed and taken by the next generation to lead us into the future. So thank you very much. That's my presentation. I'm very happy to take any questions from anybody. But thank you.
Thank you very much, Natasha. And I noticed that word respect came up again, as it has through a number of presentations this morning. There's a question that came in that's a bit more general, but I think it might be something you're really an expert in. It says that many elders are reluctant to reach out for support when experiencing abuse and neglect. I'm sure you've seen that over and over again. How can we destigmatize the process of seeking support for elders in our communities? So how do we take away the stigma? So what's that next step in doing that?
I think everybody just talking about it. I think making it like a national and a regional and a local conversation that everybody's talking about it and no one is turning a blind eye to it. So it's as if it's someone else's problem. We are all going to be elders one day. We have a vested interest in this as well, to not have this a big, massive issue as it is right now. So I think just talking about it and also educating, because you can't go and do something unless you've got the support of that elder to take action. They don't want to go and report their son to the policeman. They don't want the person to be in trouble with the law, okay? But if we can just talk to elders about the importance of them also setting boundaries with their children, that's a slow process. That's not going to happen overnight because it's deeply embedded in the cultural behaviors of how you can treat your family, okay? So our elders are doing the right. It's the younger generation that's doing the wrong to them based on their need for drugs and alcohol predominantly, you know? But I think just to have a widening campaign, and having this like as a ongoing, not a once a year conversation. This is something that needs to be taking place often and regular, and also empowering staff to say, no, you're not called, that's not culture. This is actually financial abuse. So you go and ask that person how you can assist them, because you don't want them to be in danger when they go home after they've reported something to a worker and the worker doesn't have any discretion or doesn't have any understanding about how to keep that, you know, subtle. The approach to fix it, you know. But you know, I came across one particular gentleman in my interviews, which was a worker at a bank, and he said we recognize in particular one man that was not able to, he didn't have the ability. The cognitive decline of our people is also a contributing factor in this situation. He recognized that he had an older client that did not have the wherewithal to manage his money. They independently went to the Centrelink and said, pay this man in daily sums. So for example, whatever his entitlement was, it came down to whatever. So let's just say it was $50. It wasn't, but let's just say it was $50 a day. That he received that money daily so he could live daily. He didn't receive it once a fortnight as you would normally do. And in addition to that, the man gave his customer small denominations like $5 and $10 notes. So if he was humbugged, the man could give away a $5 note and not his only $50 note. So you see, that's a person who's got initiative, they're being proactive, and they're working out the solution to the problem and they're taking action. So if we can just work together and own the problem as a collective and deal with it in that manner, we'll see better outcomes.
And I guess the most difficult thing for service providers often is that intersection between culture and abuse, isn't it?
It is.
And so your resources are really important in addressing that.
Yes.
So I would encourage everybody to have a look at the fantastic resources that are there, and to keep in touch with Natasha. So thank you very much, Natasha, for a really interesting presentation. Thank you so much. Goodbye. And I just remind everybody there's a Q&A box at the bottom of your, or it's on the bottom of my screen. Please feel free to put questions in. We're trying to answer them as we go along, or we will answer them afterwards. So please keep the questions coming. So our next presenter is Dr. Rachel Carson, and I think Rachel is with us. So hi, Rachel. So Rachel is Executive Manager and Senior Research Fellow, Family Law, Family Violence and Elder Abuse for the Australian Institute of Family Studies. This is really important work that Rachel's been doing. She's contributed to the Institute's Elder Abuse Scoping Studies and the Elder Abuse National Research Program. And she and the team have recently completed the National Elder Abuse Prevalence Study commissioned by the AG's department. We've been talking right from the beginning this morning, Rachel, about the need for data, the need for research, the need to understand more about prevalence, because if you understand prevalence, you can decide what you need to do about it. So we're really looking forward to hearing from you about the National Elder Abuse Prevalence Study. So over to you.
Lovely. Thank you very much for that lovely introduction, Anne. And I just wanted to apologise that I haven't been able to join you for the whole session today. Unfortunately, this presentation comes amid our Institute's biennial conference, and I'm coming to you between presentations. So my sincere apologies that I can't continue to stay with you and enjoy the discussion. I wonder if we could have my slides up on the screen, please. Thank you very much. And if we could move to the next slide, please. I'd like to acknowledge the Wiradjuri Woiwurrung people of the Kulin Nation as the traditional custodians of Naarm, the land on where I'm speaking to you from today, and to acknowledge and pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people who are joining us today. I'd also like to note that the views expressed in this paper are my views and may not reflect the views of the Australian Institute of Family Studies or the Australian Government. And if we could move to the next slide, I'll let you know that today in this presentation, I'm going to give you a brief outline of the National Elder Abuse Prevalence Study and the prevalence data in relation to different forms of elder abuse. I'm then going to provide you with some key insights in relation to who experiences elder abuse and neglect, followed by an examination of data about who commits abuse. And I'm then going to follow up with an examination of help-seeking behaviour before looking at the implications of the findings from the study. So if we could move to the next slide, you'll see from this slide that the National Elder Abuse Prevalence Study comprised of 3 elements. There was first a nationally representative study of 7,000 older people aged 65 and older who were living in the community. So I must be at pains to point out that we were not able to recruit from people living in aged care or people who could not participate due to cognitive decline. We also had a nationally representative study of the general community, people aged between 18 and 64, and there were 3,400 participants in that survey. And from both of these studies, we produced a culturally and linguistically diverse sub-study, which was based on the insights from the called subsamples from each of these surveys. There were questions, standard questions across the board, together with some questions relating directly to abuse associated with language and culture. Based on the findings of the survey of older people, the estimate for the prevalence of elder abuse among community dwelling Australian people aged 65 and older was 14.8%, rounded up to 15%. This estimate is based on experiences reported in the past year for those participating in the survey. The most common form of abuse was psychological abuse, and you'll see on the slide there it's at 11.7% or 12%. Neglect was the next most common form of abuse. For other subtypes, the prevalence rates were 2.1% for financial abuse, 1.8% for physical abuse, and 1% for sexual abuse. At 15.3%, the prevalence rate for the called subsample was not greatly different to those in the overall sample, and abuse relating to language and culture was reported by 4% of the cultural and linguistic subsample. As you can see from the slide here as well, multiple forms of abuse were reported by 3.5% or 4% as it's rounded up of participants in the survey of older people, with the most common combination being psychological abuse and neglect. When considering these data, it's very important to note that these figures are likely to be an underestimate of the total prevalence of elder abuse because we did, as I mentioned, exclude those who were not able to participate in the survey due to cognitive capacity, and we were not able to engage with those living in aged care settings. Moving on to the next slide here, we're going to look at who is experiencing elder abuse. And we can see here that the overall prevalence rates were similar for men and women. However, men were slightly more likely to experience physical abuse and women were more likely to experience sexual abuse and neglect. We found that the highest prevalence of abuse was in the 65 to 69 age group, but that prevalence for neglect rose for those in the 80+ age bracket. And again, it is important to note the limitations of the prevalence study in this context as well, because data from those who are not living in general community settings are not captured in these figures. Most people who experienced abuse described it to be serious, and when they were considering whether it was serious or not, we asked them to apply their understanding of the term serious. 28% described it as very serious, 42% described it as somewhat serious. Physical abuse and psychological abuse were most likely to be described as very serious, and seriousness ratings for financial abuse were distributed relatively evenly across the seriousness bands. So that was very serious, somewhat or moderately serious, serious or not serious. Neglect was the least likely to be described as serious, with almost 1/2, 48% of those participants rating their experiences as not serious. Moving to the next slide now, in addition to gender, some socio-demographic characteristics of people who experience abuse were salient across the abuse types. These findings suggest correlates of elder abuse include socioeconomic status, culture, and family form. Low socioeconomic status was associated with a greater risk overall, and especially financial, sexual, and psychological abuse. Owning a home with debt and being in rented accommodation, including public housing, were factors that were associated with a higher likelihood of experiencing psychological abuse or neglect. Conversely, owning a home without debt was associated with a lower likelihood of experiencing abuse. Marital status is consistent influence across all of the subtypes, with those who are either separated or divorced being more likely to experience abuse. I should also say that when we're thinking here about what is more likely or what is associated, these are associations and not causal factors. But for those people who were in those circumstances where they were in lower socioeconomic status or where they were separated and divorced, they were more likely to report that they had also experienced abuse. If we can move to the next slide, we'll now look at who was committing the elder abuse and neglect. And we found that it mostly was committed by family members, with adult children the most common perpetrators, followed by intimate partners, and then partners of adult children and grandchildren to a much lesser extent. However, we can see from the slide here that older people are also at risk of abuse from friends or neighbours or acquaintances, so not in substantial proportions in relation to those categories as well. And if we move to the next slide, we can look at the characteristics of these perpetrators in more detail. Men outweighed women as perpetrators of abuse by 10 percentage points overall, and especially in relation to physical abuse, sexual abuse, and financial abuse, as we can see demonstrated on this slide here. The prevalence study indicates that perpetrators were reported to have a range of problems, according to the survey of older people participants who reported experiencing abuse. Most commonly, perpetrators were reported to have mental health problems. Almost 1/3, in fact, were reported to have these problems. And nearly 1 in 5 were identified as experiencing financial problems. Not unexpectedly, the most common problems experienced by perpetrators associated with financial abuse were financial problems. Mental health issues were the most common reported problems for physical and psychological abuse. For sexual abuse perpetrators, problems with alcohol predominated. Neglect is quite different from the other subtypes, with physical health problems being the most common issue associated with perpetrators. For the called subsample, most abuse in relation to the 5 main subtypes were committed by family members, mainly children and their partners. However, friends featured strongly as perpetrators for the culturally and linguistically diverse subgroup as well, with the largest perpetrator group for this abuse relating to language and culture. Moving to the next slide, we can see from the data presented here that the largest perpetrator group of sexual abuse were friends. For financial abuse, physical abuse and psychological abuse, it was the children and all of the older people, as I mentioned. And for neglect, it was both the spouse or partner or children of the older person that were the highest perpetrator groups. Moving to the next slide now, although the vast majority of participants in the survey of older people had good psychological and physical health, the findings indicate that elder abuse experiences were correlated with people with poorer health and poorer wellbeing outcomes. In relation to psychological wellbeing, participants who experienced abuse were just more than 3 times as likely to fall into a score range on the psychological distress scale, indicating probable serious mental illness as those that did not. So it was 10% for those who experienced abuse as opposed to 2% of those who did not. Similarly, people with poorer health were more likely than those with better health to report experiencing abuse. Having a disability was also associated with a higher likelihood of experiencing abuse, and low social support and a lack of social contact were also associated with a higher likelihood of experiencing abuse. And again, I just point out that these are associations rather than factors that are identified as causal factors. If we can move to the next slide, we're now going to look at the extent to which older people who experience abuse seek help. At the outset, it's most important to note that help seeking is not a majority response on the part of older people who experience abuse, with 62% of the people who reported experiencing abuse indicating that they did not seek help or advice from third parties. While help seeking is not a majority response on the part of older people who experience abuse, it is notable, however, that 8 in 10 older people do take some sort of action to stop the abuse. And that involved mainly speaking to the perpetrator directly or breaking off contact or avoiding that perpetrator themselves. The issue with these sorts of mechanisms to stop abuse were that they serve to maintain secrecy about the elder abuse. But the difficulty is that for many older people, their children or partners are the perpetrators, so taking action does pose particular challenges. Other research indicates that older people are ashamed of the abuse and seek to keep it private, which provides a further opportunity for abuse to continue. Older people have also reflected that while they want the abuse to stop, they don't necessarily want to have the relative punished for the behaviour or to lose the relationship with that person, which also explains that reticence to seek help from both formal as well as informal sources of support, but particularly those formal sources of support such as the police and other services. If we move to the next slide, we can see in terms of the forms of abuse that older people were more likely to take action for, we see that action was most likely taken for physical abuse, psychological abuse and sexual abuse, and least likely in relation to neglect. For financial abuse, the proportions taking direct action by speaking to the person were among the highest at 59%. Another common action is breaking contact with, as I mentioned, or avoiding the person at 30%. Seeking legal advice was another common response to abuse in this category, as opposed to other abuse types. For physical abuse, speaking directly to the person was the response in most cases, 61%, and breaking contact with the person was at 54%. So those were the most frequent responses in relation to physical abuse. The other passive responses, stopping going out, was the next highest for response of this abuse type at 20%. Notably, seeking formal assistance of the various types was among the highest in this form of abuse, with 21% indicating that a professional spoke to the perpetrator on their behalf, 13% sought legal advice, and 10% obtained a personal protection order. For sexual abuse, direct action by speaking to the person was the most common response at 58%, but breaking contact with that person was also very common at 48%. Seeking legal protection through advice was very low at 1%, and personal protection orders were only reported at 1% also. For neglect, directly speaking with the person was the most common action taken at 48%. However, compared to the other abuse types, this action was taken less often. The passive approaches of stopping going out at 14% or breaking contact at 13% were the next most common options. For psychological abuse, the direct option of speaking to the person was also most frequent, but it was lower at 52% compared with the other abuse subtypes. Breaking contact with the person was almost as common at 49%. Seeking assistance from an intermediary to speak to the perpetrator was a common response for psychological abuse than for other abuse subtypes at 24%. And if we can move to the next slide, the key takeaway in terms of sources of support are the 7 most common sources of help, being family members at 41%, friends at 41%, followed by a GP or a nurse at 29%, professional carers or social workers at 24%, followed by the police at 17% and lawyers at 15%. The majority of elder abuse victims who took actions felt their actions were effective in stopping their experience from happening again, and that ranged between 55 to 66%, regardless of the subtype of abuse, but that ranged depending on the type of assistance sought. The proportions for actions that were reported as being effective were pretty similar across these 5 subtypes, although it appeared that actions taken were slightly lower for, or the success or the effectiveness of actions was slightly lower for financial abuse than for other abuse subtypes. The fact that substantial minorities indicated that the actions were not effective really does merit attention. Particularly high proportions of older people provided negative responses for actions taken by more than 1/3 of those people in relation to their experience of financial abuse, psychological abuse, and physical abuse. More than 1/4 provided negative evaluations of their actions taken in relation to neglect and sexual abuse. And moving to the next slide, with the proportion of the population aged 65 and over set to increase substantially, the development of an evidence-based prevention framework is necessary. Such a framework would be informed by the findings of this report and of other research, and would identify strategies that could be applied to prevent elder abuse from happening. Key areas of focus would include increasing recognition and awareness of elder abuse behaviours. In addition, the socioeconomic characteristics associated with elder abuse, such as financial strain, housing stress, and individual level characteristics such as social isolation, mental health issues, poor physical health and disability, indicate some directions for that framework. The fact that elder abuse mostly takes place in family relationships and in social contexts, though to a lesser extent, means that measures to address it need to manage potential adverse consequences for the victims, such as isolation from families or friends. Awareness raising should not only be a part of the prevention framework, but it also needs to be a part of a set of strategies that are intended to improve the identification of and response to elder abuse in the community and in service settings. In light of the findings of elder abuse largely remaining a hidden problem, proactive mechanisms to identify people who are experiencing elder abuse or who are at risk of experiencing elder abuse are particularly important. We also need to assess the existing services that we have to determine whether they are appropriate, accessible, and adequate, and to listen to what older people want and need in terms of addressing their elder abuse. And if we can move to the final slide now, just to wrap up in summary, the National Elder Abuse Prevalence Study indicates that 1 in 6 older people living in the community have experienced some form of elder abuse, with the most common type of elder abuse experienced being psychological abuse, followed by neglect, financial abuse, physical abuse, and sexual abuse. We see that elder abuse is very complex. The dynamics vary for each subtype or form of elder abuse. And we see that anyone can experience elder abuse, but that socioeconomic status and being separated or divorced were associated with a particular vulnerability. And in closing, I'd like to thank and acknowledge the participants in our research and our commissioning and funding agency, the Attorney General's Department. Our prevalence study is available to download on our website, and I'd encourage anybody with questions to touch base with me. Unfortunately, I do have to leave shortly for a presentation at the conference that I'm currently at, but I'd really encourage people to contact me directly at the Institute, and I'd be very happy to support any inquiries.
So thank you very much, Rachel. That's such an important study that will obviously drive a lot of our interactions right across the service spectrum from the work that you've done. And thank you for taking time out of your
It's my pleasure.
Conference to come. There are a few questions, so we'll endeavour to get them to you.
That would be perfect. That would be wonderful. I'd be very happy to. I'd be very happy to respond, and my apologies that I can't stay any longer. The session's due to start shortly. But I thank you for your time, and thank you for squeezing me into your program. I think it's really important, and that's one of the reasons why I wanted to make sure that I had the opportunity to speak with you all. So thank you, and enjoy the rest of your day.
Thank you very much.
Take
Goodbye.
care.
Thanks. So now we're going to hear from Dr. Duncan McKellar. It's my great pleasure to introduce Duncan. Hello, Duncan. Duncan's a psychiatrist. He was a member of the Oakden Review Panel. People in South Australia will remember the work that went on to review Oakden, which is a mental health facility where people certainly were not treated with their dignity and rights that were due to them, and the staff were under considerable pressure. So Duncan was involved in that review and then in moving that service to another location. After the closure of Oakden, he led the development and commissioning of Northcote House, which is certainly developing as an exemplar of the ways of working with people with dementia in South Australia. And Duncan's going to talk to us about being story informed. So welcome, Duncan, and over to you.
Well, thanks very much, Anne, for that warm welcome. It's a pleasure to be here, and what a wonderful morning of learning and exchanging ideas. I'm in Adelaide, as Anne said, which is Kaurna country, and I just pay my respects right now to Kaurna elders. In his book, Being Mortal, surgeon, thinker and writer Atul Gawande powerfully captured the importance of stories in meaning making. He wrote, "In the end, people don't view their life as merely the average of all of its moments, which, after all, is mostly nothing much plus some sleep. For human beings, life is meaningful because it is a story. A story has a sense of a whole, and its arc is determined by the significant moments, the ones where something happens. If we're hoping to build resilient communities, this is an important idea, informing how we engage with each other. As we come alongside and are with people, we have the opportunity to listen, observe, and connect with those significant moments that shape the arc of people's stories, the peaks of joy and valleys of misery, as Gawande put them. Just like us, people are seeking to recognise how their story works out as a whole. A resilient community will be forged through compassion, where human difference is overcome by curiosity about others' stories. Dennis McDermott was an acclaimed Australian poet and professor. He contributed profound insight on listening and learning, drawing on his perspective as a Koori man from Gomeroi country in New South Wales. He referred to Aboriginal traditions of silence, non-verbal communication, and reflection. McDermott proposed that these traditions of deep listening offered ways of de-othering the approach of non-Aboriginal health practitioners working with Aboriginal people. Important in this approach of deep listening was the ability to hold all aspects of the person's story without pulling away. McDermott said, if we're deep listening to someone, we are showing that we are not thrown by their fear, their shame, their guilt, their broken story. We can hear the whole thing. This is relevant for everyone. And it's the type of listening that fosters resilience through genuine interpersonal connection. As I've been thinking about these ideas, the phrase being story informed has been helpful for me, built around this central importance of listening to and honouring a person's story. I'm conscious that we don't need another model for providing care as such. We already have the insights and wisdom of person-centred, relationship-centred and trauma-informed care. But I think of being story-informed as an approach built on the cornerstones of empathy, compassion, and equality. Being story-informed promotes supportive attitudes of curiosity, humility, and non-judgment. And this in turn guides actions of listening, learning, and imagining. This last action, imagining, is so important as it enables us to see alternatives to the way things are. It can give hope, and that is a key for resilience. As a psychiatrist, I often encounter people who are experiencing significant life challenges. When working with a person who is in dire circumstances, someone in distress, a person with dementia or disablement, or someone who is dying, we are not merely looking back on their narrative. Their story is still being written, even at the ending of life. And by imagining what might be, what might shift in them or their circumstances to ensure the retention of dignity and meaning, we can help infuse hope into a person's situation. Gawandi understands this well. He has pointed out that the most cruel failure in the treatment of older people and those who are ill is in failing to recognise a person's continuing drive for existential significance over blindly prioritising issues of safety and survival. The chance to shape one's story, he states, is essential to sustaining meaning in life. A little while back, I heard the story of a couple in their 90s, Stefan and Mara. Their situation was heartbreaking. They had been together for over 70 years, having been sweethearts from childhood. Their families had been neighbours in Romania in the 1930s. They had endured hardship and trauma. Marrying in their late teens, they had escaped war-torn Europe for a new life in Australia. They had a daughter, Sophia, and she had grown up a first-generation Aussie with new opportunities and expectations. She'd married, and Stefan and Mara had delighted in their grandchildren. As the years passed, Stefan and Mara had taken steps towards the frailty that actually comes to everyone in the end. Mara was diagnosed with dementia. She progressively forgot more and moved less. Circumstances conspired and they could no longer live in their small home. Both were placed in residential aged care. After 70 years in constant companionship, their concessional status meant that they did not have the resources to access a couple's room, and they were accommodated on different floors. Mara was lost and alone, unable to make sense of where Stefan had gone. Stefan was heartbroken. It's a remarkable thing that the experiences considered traumatic at earlier stages of the lifespan, such as forced relocation, separation from loved ones, and the acquiring of a disability, are frequently dismissed as normal and expected for older people. They are every bit as traumatic. And that was the experience of Stefan and Mara. Sophia began to advocate, seeking to ease her parents' distress. She appealed to the facility. Our couple's rooms are all filled, she was told. There's nothing we can do. Her advocacy turned to agitation. She desperately argued for their mental health. In 70 years, they've never been apart, she pleaded. They're becoming depressed. You can't let this happen to them. Sophia wrote a letter to her local member of parliament. The local member wrote a letter to the federal minister. The minister wrote back expressing sympathy, but explaining that there was nothing he could do to help. It was up to the aged care provider. The sympathy sounded hollow. The local member forwarded the letter to Sophia, and coming from the other side of politics, he was quick to point out that this was both disappointing and typical of such a government. He then closed the case with a similarly hollow thud. When Stefan and Mara's story crossed my path, I was outraged and saddened. My first thought was that we could surely do better at finding a solution to what seemed like a relatively simple problem. It's the business of aged care providers to hold people's stories with dignity and respect and honour. How could they not see that it was not okay to tell a couple in the last days of their lives, after 70 years of togetherness, that they must suddenly adapt to a life of separation? There was a disturbing absence of story-informed kindness and care. Sophia reached out to Aris and received support as she persisted with her very reasonable request that her parents be brought together. She knew that in the deep, dark hours of the night, the only soothing balm for their shared distress was each other's presence. But the weight of grief, shrouded in the shadowy veil of confusion and unfamiliar surroundings, took its toll on Mara. She lost interest in getting out of bed and then stopped eating. And a short while later, with the matter still unresolved, she died. Stefan remained heartbroken. And then, a week later, a picture of another couple, Margaret and Derek, appeared on my social media newsfeed. Both were 91. They'd been married for 70 years. They were sweethearts from the age of 14. It was like a parallel universe. Margaret and Derek had been admitted to separate NHS hospitals in the UK with their own complications of frailty. In hospital, Margaret contracted COVID. The doctors and nurses quickly recognised the limitations confronting them, and in the face of the intensity and widespread trauma carried by NHS staff, compassion prevailed. Derek was moved from one hospital to another so that he could be with his wife. Derek subsequently caught COVID too. To be honest, his daughter reported, he probably wouldn't have had it any other way. There was no way he wasn't going to go and see her. After 91 years of living, 70 years of love and companionship, 5 children, 11 grandchildren and 4 great-grandchildren, Derek and Margaret slipped beyond life within 3 days of each other. Their last photograph, which Sakina is going to put on the screen now, was taken in hospital by their daughter. It's poignant, beautiful, and heart-wrenching. With hospital beds jammed up against each other, Derek and Margaret can be seen reaching out to one another, their 4 hands intertwined. It is clear that Margaret, weakened and frail with exhaustion, drew comfort from Derek's touch. Derek's face, overwhelmed by emotion, welled up with love and tears, is the focus of the image. Amid a pandemic that battered the NHS, the story of these two people was honoured. The foundations of empathy and compassion remained intact. That is resilience. By being story-informed in work, relationships and life, we see beyond the immediate and can consider a whole narrative with its twists and turns, traumas and triumphs. We recognise that at the end of the day, what everyone craves is human connection. We need each other. We need to know that we are valued and that our lives have meaning. At the centre of everyone's story is a need for compassion, hope and humanity, for love. And if we lean into this way of living, we might foster a more resilient community through mutual support. It's simple and it's true. And every one of us can bring something of this to our part of the world each and every day. Thank you very much.
Thank you so much, Duncan. I think that reminds us of how important the work we do is in our connections. I was thinking the very beginning presentations this morning, we heard about how maybe as we get older, our physical resilience declines, but our emotional resilience has a strong potential to increase. So if our emotional resilience is met from the service end by the empathy, the compassion, the curiosity that you're talking about, that coming together is the strongest connection, isn't it, to make us hopeful for what our future is going to look like. So thank you very much indeed. I think there's probably not a dry eye in the house after seeing that last slide as well. Thank you for all your work. It's been so important. People might not know that Duncan's leaving now to go to Scotland, but his work in South Australia has just been wonderful. So thank you very much, Duncan.
Thanks so much, Anne. What a pleasure to be here. What a great morning.
Thank you. All right. So now, everybody, we're on to our very last, but certainly not our least presentation. And we have Erkai Wong with us. Erkai, welcome. Erkai is a solicitor with the Older Persons ACT Legal Service, that's called OPALS. She's a lawyer and a registered migration agent with Legal Aid since 2021, when she took on the role of Solicitor Older Persons Legal Service. So OPALS is a specialist service that provides legal advice and assistance and legal representation to ACT residents who are over 65. So, okay, I'm going to hand over to you.
Thank you. Thank you so much. Can you hear me okay? Oh. Sorry, I gather that you can hear me okay. All right. And I have tested all my audios and videos and things like that.
Yes, we can. We can hear
you. Okay, great. Thank you. Thank you so much. My name is Erkai Wang, and I do have a few slides to go through. And I must say that I had a great morning learning and listening from the presenters and also the people who ask questions. And I have, you know, the great pleasure of working in the older law sort of field. And after all these wonderful presentations and now people, let me give you a bit of law. And as you know, that my name is Erkai Wang, and I have been only in this role for about, not quite 12 months. You know, I have been enjoying it very much. And I am speaking from the land of Ngunnawal people. So next slide, please, is my acknowledgement of country. Yes, thank you. And I do want to acknowledge the Aboriginal and Torres Islander people, their elders, past and present, and also those who are present here today in this forum. And I'm going to talk a bit about what's happening in the ACT jurisdiction. Next slide, please. And here is just a little bit of an agenda that guides me through what I'm going to speak today. I'm going to just discuss a little bit about ACT's new law on criminalising older abuse. And then our older abuse experience during COVID. It's very similar to elsewhere, but I'm just going to go through that quickly. And I'm going to talk a little bit about how I see the way forward, and also, tell you a bit about what Opals do or does. Next slide, please. Okay, so this legislation came into effect last year on the 20th of April, and ACT is Australia's first jurisdiction that criminalise elder abuse. So when the bill was discussed in the ACT among the community and also different sectors, it was fairly controversial. Well, criminalising elder abuse is a controversial issue many years ago. So it's not just the ACT who started talking about it. And in fact, it was the model came from the US, and we had a lot of discussions among the ACT, lawmakers and the community about whether elder abuse should be criminalised. And eventually the legislation did come through. And then, we became the first Australian jurisdiction to do this, which is, controversial, but at the time, and it was a bit progressive as well to some people, but obviously other people raised concerns about what it will do in the area of older law. Next slide, please. So I'm just going to give you a little bit of flavour of what the new law does. The design of the new law is actually quite specific. It focuses on the care providers and also institutions that provides care to older people. So the new law introduces new offences for the abuse of vulnerable people, and there is a specific definition, as you can see on the slide, that is in the legislation as an adult with a disability or who are elderly, age 60 and over, and with a vulnerability or experiencing social isolation. So the new law also criminalises neglect of a vulnerable person or the failure to protect a vulnerable person from a criminal offence. And obviously the vulnerable people in care with institutions, but in their home, if the carer commits the criminal offence, that's punishable under the new law. Next slide, please. So now I'm just going to go through the legislation quite quickly, as you can all read on the slide. So the sections are section 36A, B, and C have section 36A, 36B, and 36C covers the particular offences. So next slide, please. So section 36A covers abuse, And section 36B, that's the next slide. Section 36B covers failure to protect. So that's if a person is in authority of a relevant institution, and if someone is associated with that institution and fail to protect the vulnerable person in their care, that could be a criminal offence in certain circumstances. Next slide, please. 36C is the covers neglect of the vulnerable person by carers. So this section creates an offence if the carer who's responsible for the vulnerable person, and that failure could amount to criminal offence of under 36C of the Act. Next slide, please. Now, we're talking about maximum penalty here. Obviously, it's up to the court, if convicted, what kind of appropriate penalty applies for a particular offence. But the legislation lists only, as you can see there, the maximum penalty. So for abuse, for elder abuse, if the person's conduct result in harm, so harm is or serious, well, if the conduct results in harm, which is defined in the Act, the maximum penalty is for imprisonment of 3 years. So serious harm would warrant imprisonment of 5 years maximum. So both of these terms, harm and serious harm, are defined in the Act. And for failure to protect, and those offences are covered under section 36B, then the maximum penalty is imprisonment of 5 years. And for neglect, again, it's a 5-year imprisonment maximum penalty, or 500 penalty units. So as you can see, the punishment can be quite severe. That's how the legislation has provided. Next slide, please. So just a little summary of what the new law does. And as you can see, the law has been designed in a particular way to capture elder abuse perpetrated by care providers and institutions that are responsible for providing care to older people. And as you can also see that some of the older abuse perpetrators, as we have discussed in this forum, and also in the prevalence studies, older abuse prevalence studies report, some of the perpetrators, or a lot of the perpetrators, are not covered by this law, which is I guess some of the criticisms of this legislation. The second thing is that the new law works on the premise that no harm, no offence. So so the legislation has been framed in such a way that the conduct, or the criminal conduct, has to cause harm or result in someone obtaining financial benefit to the detriment of the older person. So if harm cannot be established, that's how the legislation is designed, that no offence is committed. So that's the basis of charges, and also the conviction mainly. And the third point is really about exemptions and defence. And there are exemptions and defence available under the legislation, as you probably have already read. So it just means that under certain circumstances that there are exemptions and there are defence available. And I'm just trying to check on the defence, because one of the defence is that if the elder abuse happens beyond the perpetrator's control, you wonder what that is, but that is definitely have been put in legislation that could be a defence to the I guess the charges of elder abuse. And it is available to for anyone who's the respondent of elder abuse to argue. And the last point is really about when we see the elder abuse prevalence studies, we get this impression that it happens a lot in our community. And certainly that's experienced in the ACT jurisdiction. But at the same time, the conviction rate is not that high. And in fact, I'm not aware of any conviction whatsoever. Definitely since the enactment of this new law in the ACT, there's no conviction. There hasn't. I'm not even aware if there are charges being laid when elder abuse had been perpetrated by the family members or care providers or institutions. Not yet. Maybe it's because it's relatively new law. We're yet to see how it's going to be used by victims. Next slide, please.
Okay, sorry to interrupt. Just to let you know, we've got 4 minutes to wrap up.
Yeah, that's fine. Thank you so much for letting me know. I was just going to say quickly that the impact on older people during the pandemic is very similar to what other speakers have been talking about. And so there's really not a lot of surprise there, other than to say that, here at Legal Aid, we received the calls from people who are seeking more like a legal help, because we're not like an advocacy or support service to older people. We're a legal service. So, but the type of inquiries we receive are very similar to other jurisdictions. Next slide, please. Just a bit of difficulties. So then again, that what I have seen in my role as an OPPO solicitor is the services. A lot of the services do not have a culturally appropriate professionals and programs to assist people from culturally diverse communities. That issue has been raised with me by many of the callers, and part of the difficulty is really to speak to someone, not just about the language, but have that cultural understanding in dealing with elder abuse issues has been difficult and makes a lot of people reluctant to engage with the process. So it's not just about the legal process, but also just the process of trying to make things better in their situation, which has been quite difficult. And lack of housing options is one of the biggest issue in dealing with elder abuse during the pandemic. It's not getting that much better as we're sort of moving towards the end of, or we hope it's the end of the pandemic. So we'll see how that goes. Next slide, please. So there are just some of the challenges people have been speaking about. The second point is about the cultural awareness, which I think is significantly lacking. This is just from my experience sitting here with the ACT Legal Aid. I'm sure it's shared by other jurisdictions, and so we're working towards raising more cultural awareness in our services. Next slide, please. So here are some suggestions of change. As you can see, having some culturally appropriate community education on older abuse, it would be my, top priority. So that's the kind of thing I'm advocating from where I'm sitting. And, obviously it requires a lot of resources and time for it to happen. Next slide, please. Just a little bit about OPAL's role. I don't intend to spend too much time on it, other than to say that it's a legal service that offers free, confidential, flexible legal service to people in the ACT. Next slide, please. Yep, so they are the kind of things we do: education, legal advice, referrals, and representation. Next slide, please. Here are our contacts. Thank you so much for the opportunity to speak, and I really appreciate it. Have a great one, everyone.
Thank you very much, Kai, and I liked your slide about the challenges, the ways forward. I'm sure we'll all work through those and make sure our services are culturally accessible and appropriate as well. So thank you to everybody who's joined our forum today. And we're just going to put up a poll. We're always really keen to get feedback. So please feel free to fill that in for us. A very big thank you to all our panelists for sharing your insights and expertise. Thank you to our sponsors again, our champion sponsors at Dementia Australia and Aged Care Industry Association, and our supporters of Adelaide PHN, ECH, Rest Haven, Southern Cross Care, South Australian Community Visitors Scheme, Flinders University Research Centre for Palliative Care, Death and Dying. And a reminder, if you've got a passion for the rights of people, I'll encourage you to go to ARIS's website and sign up and join us to become a member. So thank you very much for the ARIS team who have put this together, particularly to Sakina and Leonie. And to the rest of you, thank you very much for being with us today. And I hope you have a wonderful rest of the day. Thank you. Goodbye.